So as you know, consent is a very, very important part of any treatment. So the what consent definition is: consent is voluntary and continuous permission of a competent patient to receive a particular treatment based on patients being informed regarding the purpose, nature, and likely risks of the treatment, including likelihood of its success, any alternatives to it. Permission given any under any unfair or undue pressure is not consent. So consent is, you cannot assume that if the patient is saying yes, you assume that he has understood the treatment and he is ready for it. So as a dentist, it is your legal responsibility to explain the whole process of treatment to the patient, including the cost of the treatment, what are the risks, what will be the procedure, what will happen if he doesn't take the treatment. And after that, if the patient has understood everything and he is ready for the treatment, then only we should be get starting the treatment, and ask him at every step that if he is clear of what you have explained it to him, and if he's okay to go ahead with the treatment. Is it clear to you, Aisha?
Yes, yes, it's
Yeah.
clear.
So treatment without consent is an assault or a battery. This is this is sometimes a question in the exam. what
Okay,
what
so
will
it's assault and battery if we don't ask for consent.
Yes, if ask more than ask, that he might say that a patient might say, okay, yes, I said yes, but I didn't quite understand what does the
Uh,
process
so
involves.
it's important for the patient to understand the entire procedure
Exactly.
before giving the
Yes.
consent.
Every step, every risk, all the details, the cost, everything has to be explained well, and very well understood by the patient. And we should not, as a dentist, assume that if he or she has said yes, it means he's understood. So giving a yes for the treatment doesn't actually means that it is a consent for the treatment, right?
Yeah.
Yeah. So what are the types of the consent? This is all these definitions are very important. They can be asked in as definitions or as a scenario that this is the process you're going to do, and this is the consent patient has given. What kind of consent is it is? These are also very commonly asked question on consent. Okay.
Okay.
Express consent.
Yeah.
A patient gives express consent when he or she indicates orally or in writing to undergo examination or treatment, or for personal information to be processed. Now, this personal information, if, for example, you want to refer a patient to an implantologist or an oral surgeon, for that you might not need a consent of sharing the information, because you're sharing it for as a part of the treatment plan, right? But if you want to share
Yes.
the information, for example, an insurance company, for that you need a explicit and a written consent from the patient that he or she is ready for you to share the information. So that's
Do you need
express.
consent to send their procedure to the insurance company also? I
Yes.
thought they just need consent for the treatment.
No, no, no. You need
Oh,
any details apart from treatment plan, or for any references you use, you need a consent from the patient to share any kind of information that actually comes under data protection.
okay. Yeah, yeah.
Yeah.
And if do you need consent for like I know you need consent for the treatment that you're doing, but before the treatment, like when you do the clinical examination, like initially when you just examine the
Yeah,
oral cavity
that's
to
what I'm
diagnose
coming
the
to.
patient.
Yeah, that's what I'm coming to. Sometimes it is an implied consent. In a very limited circumstances, consent may be implied. An example, when a patient is indicating agreement to an examination by actually lying in the dental chair and opening their mouth. So it is kind of
Uh,
an implied consent. For example, patient has come and he is obviously here to get a dental checkup. So he is sitting
yeah.
on his chair and we ask, are you ready? So it is kind of an implication that yes, he's ready for a checkup. Not maybe for the further treatment, but for today's checkup, he's ready. Clear?
Oh, yes.
Yeah, that's an implied consent. Now, one is the informed
Yes.
consent. Informed consent requires full explanation of the nature, purpose, and material, risk of the proposed procedures, and the consequences of not having a treatment in a language that patient can understand, using an interpreter, visual aids where necessary. For example, patients with a language barrier, if they don't understand English very well, you might
Hmm.
need a translator, right? For example,
Yeah.
if a mom comes with a child who needs multiple extractions, and or
Yes.
maybe he needs to be admitted to a hospital to be done under GA, that needs a written informed consent. If, for example, if that mom doesn't understand English, you might need a translator or a visual aid to explain the mother in detail that, look, this is the procedure, these are the risks which are involved, and if you understand, then only you can give your consent. Or otherwise, she might say, I'm not ready now. So you say, okay, fine, then you might use some other method to explain to her in detail. So that is full explanation is called an informed consent. Okay?
Okay.
Yeah.
Yes.
Specific consent. Specific consent means that the patient consents expressively to each procedure to
I
be.
have one question. Can you like differentiate between like in expressed consent, we still give the full information, right? What's the
Yeah.
difference between the informed and expressed consent?
Informed and
Isn't it
which
very similar?
consent, sorry?
There was like before implied consent, there was
Yeah.
expressed consent, right?
Express consent is like, it can be given orally as well. See, this can be given orally for examination or a treatment, but for informed is that he or she is agreeing in writing that, I have understood the complete procedure and I'm ready for it.
Okay.
Yeah.
Okay. Okay.
It is a more
Yes.
informed is a more detailed sort of,
More detailed.
yeah, more detail.
Okay.
It is usually involving more like impactions, or more complicated treatments like
Complicated
implants.
procedures.
Yeah,
Okay.
yeah.
Yeah.
Specific consent is, if the specific consent means that the patient consents expressively to each of the procedures to be undertaken. An agreement to undertake course of the treatment without knowing what is to be done is not a specific consent. Specific consent is, for example, I say a patient requires a composite filling today. So he says, I'm not ready for all other treatments. My specific consent is only for this filling.
Okay.
So
Just
when
for like a one procedure, not
yes,
a whole
expressively, yes,
process.
to each procedure that has to be done today. He might need multiple things. He might need scaling also. He might need a root canal also. He gives specific consent for each and every process. Clear?
All right. Yes.
Yeah. Restricted consent. Restricted consent is sometimes patient will consent to a part of the treatment plan but withhold the consent for treatment that may become necessary so that the procedure can be given further consideration. So it is like, he will say, I am ready for half of this. If you explain the full treatment plan to the patient and he or she says, I'm ready for this specific point, I'm not ready for this specific point, he is restricting his consent to a particular part of the treatment plan.
But isn't that specific consent and restricted consent the same thing? Because he's
Uh,
agreeing to only some things, like at
No,
one procedure, not all of them.
there is a difference. There is a difference. There is a very thin difference. Specific consent is he is giving his consent for individual component of the treatment, right? In restricting,
Yes.
he is holding his consent for a particular treatment. He's
Oh,
he's holding.
okay.
Yeah, he's
Yes,
saying,
yes.
I'm not ready for
Withholding.
root canal, but I'm ready for composite, right? And in
Yes.
specific consent, he's saying, I will give my consent for composite maybe later on, but today I am giving my consent for a root canal.
Okay, okay.
Yeah. There is a very thin
Yes.
line in between restricted and specific. In specific, he is not saying no to the treatment. He's saying maybe later on, I'm not ready today. Restricted, he's saying, oh,
Okay.
I'm not sure about the root canal. Let's do the composite today.
Okay.
Clear?
Yes. Yes, yes.
Yeah. Now, valid consent. This is very important. It is very commonly asked. What are the features of the valid consent? For the consent to be valid, it must be specific, informed, and normally be given by the patient or a parent or a guardian. If the patient is 16 years, under 16 years and is unable to give the informed consent. So consent.
Uh, actually,
Mhm,
I have like there is no electricity today because there's like a lot of rain and thunderstorm.
mhm,
So I have 20% batteries. I think like the lecture will be done by then. But if
mostly.
like if it's like if the phone if we lose connection and the phone gets turned off, it means like I can't turn back on because there is no electricity right now. So
Okay,
I'm just
no problem.
informing you before.
Yeah, that's fine.
Sorry.
I'll send you the link for the mock test. Maybe you can do it tomorrow then when the current is back, right?
Yeah, it will. I think it will be back by tonight, though. And I'll do it as soon as possible when I
Okay,
get
fine. No problem.
everything set.
Let's carry on now, right? Yeah.
Yeah.
So the consent has to be valid in any situation of the treatment. There is no excuse
Okay.
for you to skip this valid consent point at any point of treatment. And during the course of the treatment, you have to check the patient's understanding again and again. Is it clear to you? Do you want to ask me any specific questions? So it is you're cross-checking and taking the consent again and again between the treatment as well, right? Might be the
Okay.
patient said yes in the beginning, I'm happy to get the root canal, and in the middle of the treatment he feels, oh no, I'm not confident. Then you should, you have to cross check his understanding again and again. That's also a process of
Okay.
taking consent at every step of the treatment. Okay.
So we have to like keep counseling the patient to make him understand that
Exactly.
he, like you can't
Yeah.
stop the treatment.
Yeah. A dentist has a legal requirement to obtain the valid consent of the patient to the treatment proposed. Before carrying out an examination or treatment, valid consent must be obtained. For a consent to be valid, the patient giving the consent must be, of course, competent to give it. That's why he can
Give it.
give,
Yeah.
right? He has to understand it.
Yeah.
Adequately informed of the nature of the procedure that is being agreed to, in a position to give consent freely. It means he should not feel under any pressure or any sort of misunderstanding from dentist's behalf to give the consent. Yeah.
Yes.
Yeah. Who can obtain a consent? Consent for examination and treatment must be obtained by the dentist. Normally the dentist who is undertaking the treatment. In no circumstances obtaining the consent can be delegated. I mean, you cannot tell your nurse to take the consent on your behalf. It is
Okay.
only the dentist who is treat. This is a question which is asked in the exam. Who can take the consent? Dental,
On
dental nurse, dental hygienist. No, only the dentist who is taking the
dentist.
treatment can take
Yes.
the consent. Yeah.
Yeah.
Now, who is competent to give the consent? This is also very commonly asked. Any of these points can be
Yes.
asked as a multiple choice. A patient must be comprehend and retain the relevant information, believe it, right? He should have confidence in his dentist while doing the treatment. Yeah.
Yes.
Weigh the balance so as to arrive at a choice and communicate their decision, whether by talking, using sign language, or any other means. The patient might not be, might not be able to read or write a particular language, but he or she
Yeah.
should be able to understand your instructions very clearly without any confusion. Then only he
All
is
right.
competent enough to give the consent. Okay?
Okay.
Yeah. Consent for children. Consent for children is like those aged 6 to 7 years are presumed to have the competence to give the consent for their own treatment. Younger children who understand fully what is involved in the proposed procedure can also give the consent. Ideally, their parents should be involved. But if they say, yes, we understand what's going to happen today, they can also give consent for their treatment. But ideally, parents are responsible, biological
So
parents.
both should give the consent. Like if a child comes who's 7 years old with a guardian, so what if the parent is not agreeing to it and the child says that he understands and gives the consent? So what do you do then?
Then you should go ahead with the treatment. That's a Gillick competence. I'll come to that. It's a next point.
Okay.
Yeah, see, this is
Okay.
Gillick competent. A child under 16 years can give consent for their own treatment if they are believed to have enough intelligence, competence, and understanding to fully appreciate what is involved in treatment. This is known as being Gillick competent.
They're competent.
Yeah.
Okay.
So if they're 16 years, anyway above 16 years, they are legally have, they can give the consent. But under
Okay.
16 also, if they say, okay, we are confident, go ahead with the treatment, uh, they can give the consent for their treatment.
Okay.
Okay. Yeah.
Yes.
When the consent is not obtainable, there are many situations, for example, accident, the patient is unconscious. What will you do? How will you obtain the consent? This is also sometimes asked as a scenario in the exam.
Yeah.
Yeah. Where consent may not be obtainable, for example, in cases of incompetent adult, unconscious patient, or an emergency, the same basic principle applies. The professional has a duty to make up their own mind and to act in the best interest of the patient. This is very important. Take a second opinion where necessary. In case of unconscious patient, practitioner should carry out only that treatment which is necessary and should await such time as the patient will be able to consent before taking procedures. So, for example, if there is any medical emergency, right, you can't take a
Yeah.
consent, but you do only the treatment part which is necessary to save the patient's life and
Yeah. So we have to
hold,
do a life-threatening part. We
yeah,
should do like the
yeah,
life-saving.
just do the emergency treatment, and rest of the treatment you can wait while the patient is conscious or in a position to give the consent. You should
But
not
they,
be,
but patients have like emergency contact, right? Do you call the emergency contact, or you just like
you
don't take
can if you
consent and
have
just treat it?
time. For example, if the patient is bleeding heavily, you don't have time to call their, or if it's a road traffic accident, how will you find
Okay.
their emergency contacts or whatever? So at that time you
Yeah.
only
Yeah.
manage the life threatening situation, and later on when they are conscious enough, or when you find the numbers of their family members, call them. Okay.
Okay.
Yeah.
Yes.
Mental Capacity Act, it is, it is usually for those people who are over 16 years of age but are not mentally competent enough to give the consent. For example, patients suffering from dementia and other mentally
Um.
challenged patient. So in that case, only particular set of people are there who can give consent on their behalf. Doctor cannot decide on his own that, okay, fine, I feel this is right, I will do it. No, you cannot do that.
Okay.
It is the Mental Capacity Act enables an individual with the capacity to give another individual a lasting power of attorney, LPA, to make a medical decision on their behalf should their capacity be impaired. For example, if an old 75, 80 years old man is there, and for example, he is suffering from dementia or Alzheimer, so he will make,
Yeah.
might be his lawyer. There are attorneys which have this, which have a authority, or the person has given the authority to their particular lawyer that, look, if something happens to me or if I'm not able to give my consent on my behalf, you can give a consent for my treatment. Or he might make his son or daughter his, on his behalf to give the consent. So that's the Mental Capacity Act. So if the
So
person
what
is,
do you do if someone who's born like with Down syndrome, someone who's like a child who has Down syndrome, but then he becomes an adult, like he's over 16 or
then
17,
usually they
and
have,
he's
please go ahead.
and sorry, I just meant that they don't like. Do they parents still give consent for them?
Yeah, their parents are usually give consent for them, even if they are over 16 years of age and they are not competent enough. If parents are not
Yeah.
there, then they will put some, authority or a lawyer or somebody else as
Oh,
their representative when they are meant to get a treatment. Yeah.
okay. Yeah.
5 important principles of Mental Capacity Act is presumption of capacity, ability of a person to make a decision from themselves. You cannot assume that a patient is not smart enough or not competent enough to give a decision. Our job is to explain the details to the patient and make sure patient knows everything and judge for himself. And if he says no, I
Okay.
can't take a decision, then it's the second step to contact somebody else on their behalf to take a decision. But our best ability should be to use patients ability to give the decision on their behalf. Okay.
Okay.
Yeah, right of individuals to be supported to make their own decisions. So as I explained, that make sure you explain every details of the patient, of the treatment, maybe repeated 2 3 times, and help them to take a decision. People are allowed to make unwise decisions. This is very important. If somebody is
Yes.
coming there with the acute abscess and you say it is a good idea to get the tooth removed, and he says no, I don't want it, in your heart you know that that's best for him, but he's not ready, you can't override his decision. It is his tooth, it is his
Okay.
decision. He says so they are allowed to take unwise decision, right? They say I don't want the
Yes.
tooth to be removed. You can say okay, fine, I will give you some medication and then we'll take it from there. Okay.
Okay.
Best decision should be made in the decision should be made in the best interest. So you can't force your treatment plan on somebody. Just
But
make
what if it's the unwise decision is like life threatening? Like if the infection is spreading to the facial spaces and like stuff like
See,
that,
yeah,
that could.
these rules are here to make sure that we don't override patients' basic rights.
Uh,
Usually, patients
yes. Yes.
listen to you. 90% they listen
Yeah.
to you. They understand that we are here for their good, right?
Yeah.
Yeah. Least restrictive intervention. Anything done on behalf of a patient lacking mental capacity should be least restrictive of their basic rights and freedom. So, as we discussed, only do the emergency treatment. Do not extend to the non essential part without their consent. Okay.